Okay. Hi, everybody. My name is Dr. Arinola Dada. I'm a rheumatologist in the greater Seattle area. I help people with joint pain and autoimmune disease become pain-free and get the immune system back on track. So the point of this video is to talk about what to expect when you go visit a rheumatologist. So your joints have been sore and stiff for months. Your doctor says, hey, it's time to see a rheumatologist who specializes in musculoskeletal diseases and autoimmune diseases. So you may not necessarily get the final diagnosis right away, but it is important to start the process, right? So for a number of autoimmune diseases and arthritis, the early diagnosis is important. Being a partner in the process is important to ensure good outcomes. So at Overlake Arthritis, our job is to help you and work as partners with you towards a healthier you. So I made this a two-part video series. One, this is a knowing what to expect, and the second one is how to prepare. So this is going to be knowing what to expect. So I think thinking about your doctor as a partner and as a detective, so that you provide your doctors with clues to help make the diagnosis. So there are a number of things that your doctor is going to go through, and that'll probably even be any doctor that you see, but specifically we're talking about rheumatology here. The information that they will be teasing from you, asking you questions that may seem somewhat irrelevant. For instance, if you come in with knee pain, your doctor may want to know if you have diarrhea, right? Or if you have celiac, or if you have intolerances or malabsorption, or if you've ever had skin lesions like psoriasis. So there are a number of things that your doctor is trying to tease out of the medical history that may not necessarily be obvious to you, but they're important to help your doctor find clues. There'll also be family history. Your doctor will want to know if any members of the family have any kind of arthritic conditions, because some have a genetic component, right? So when you make your appointment, there's usually a form you can fill. You can download and fill out your medical history forms in advance. I think this does save you valuable time when you visit your doctor, okay? It's always a good idea to have an updated list of your medications and allergy. The next thing that your doctor would look at is a targeted physical exam. Typically, I'm looking at your hair, depending on your history for hair abnormalities. Some people like lupus. Some people with lupus may have hair loss. Some people may have psoriasis. Sometimes I'm looking at your eyelids when you're talking. I'm looking at your mouth. I'm looking at your hands when you're talking. So the most important part of the visit is your doctor also looking at your joints. For us as rheumatologists, you want to see if it's swollen, if it's tender, if it's red, if it hurts just when you touch it. And finding out where your hurt is very important, as well as what kind of range of motion you have. So we'll be moving your joints around and want to kind of see what range of motion that you have, because even if you're not having pain, the body may find a way to minimize how much you move it so that it does not cause you pain. The other thing that rheumatologists will be doing will be looking at laboratory tests. So we may look at the laboratory tests that your doctor has done, but typically we usually have additional tests. For instance, there's specialized tests for rheumatoid arthritis that we'll be looking at, specialized tests for lupus. Usually your primary care doctor may have done like an ANA test, but when you come to our clinic, we'll probably be doing a much more in-depth analysis on the ANA because there's a high incidence of false positive. Sometimes for those patients that have swollen joints, there may be a need to take fluid out of the joint. Typically, we numb that up and then we aspirate the fluid and we send the fluid for analysis. And that analysis of that fluid may help to determine if the patient has more osteoarthritis or inflammatory arthritis, or help us to categorize why that joint is swollen. Sometimes you can make a diagnosis of gout or even pseudo-gout from that. X-rays are helpful. They're not particularly helpful at the beginning stages of arthritis, but usually we like to get it as a baseline. Ultrasound, sometimes we refer patients to get ultrasounds done, and MRIs. Just depends on what the history is leading to. I think one of the most frustrating things that patients may notice is that we typically will not have a diagnosis on the first day, unless unless it's very severe, or unless it's obvious, right? A lot of times we have to do blood tests. I tell my patients it's a fact-finding mission, right? So a lot of times we'll have to do blood tests. Sometimes the primary care doctor has basically done all the tests and then it's easy from there. But a lot of times we're still analyzing, we're still fact-finding. We want to make sure that we give you the correct diagnosis, or at least we narrow and eliminate other differentials, so that we are providing you with the best information, the most accurate information that helps you moving forward. So my name is Dr. Arinola Dada. I hope this is helpful. When I want to reduce the anxiety from when you're coming to see your rheumatologist, and we're usually very friendly doctors. We just want to gather the information. Lab tests, x-rays, blood tests are things that we need to help us make sure that we're getting you the right diagnosis, and then we help you towards a healthier you. So if you're in the greater Seattle area, look us up. My name is Dr. Arinola Dada. Take care.